Hello, everyone. Welcome, welcome, welcome. I know some of you are still coming in, getting connected. Let's give people a few minutes to come in before we get started. Um, if I haven't met you before, my name is John Rakoczy, founder and CEO of Assure Occupational Testing, and happy to be with you all today and talking about exposure to asbestos, silica, and coal dust. And we're going to get into what are the Alberta OHS regulations and what are the Saskatchewan OHS regulations to make sure you and your company are staying compliant with OHS and making sure that you are protecting the health and the respiratory health specifically today of your workers. So that's the focus of today. Understanding Alberta and Saskatchewan OHS codes as it pertains to, specifically today, as it pertains to exposure to asbestos, silica, and coal dust. So a little bit more about, before we dive in, just a bit about us and who we are. Again, my name is John Rakoczy. 15 years this summer, we just celebrated at Assure Occupational Testing of helping companies ensure that your workers are fit for duty and that your workplaces are safe. So we do that through drug and alcohol testing, occupational health testing, audio testing, mask fitting, pulmonary function testing, health assessments, physical abilities assessments, substance abuse, professional assessments. So from start to finish, we help you stay compliant with OHS and maintaining fitness for duty in the workplace. We also do supervisor training. So virtually and in person, we can come to your boardroom and make sure that your management and that your supervisors are all on the same page when it comes to managing impairment in the workplace and specifically reasonable cause situations. To make sure that your team is on the same page with how you handle and manage reasonable cause situations. So we've got a certificate course around that, supervisor reasonable cause training, as well as employee-specific training around that. So we offer that virtually, as I said, and we're available to come on site, bring it right to you and to your team at a date that works for you. And all of the services that I just mentioned, basically most of them, I would say 95% of the services we are able to also bring to your site in our mobile clinic. So the trailer that you're looking at on the screen there is half of that trailer is a soundproof room where we're able to test 4 workers, complete an audio test on 4 workers at one time. Brand new state-of-the-art audiometers, testing equipment to complete the audio testing. So we can be doing that in the back of the trailer while another technician is completing mask fitting, hearing protection fit testing, drug and alcohol testing in the front. So it's a bit about us and what we offer here at Assure Occupational Testing. So again, so glad you're here with us, whether you're here in person or watching the recording. What our focus is today is exposure to understanding, how do you best care for your workers who are exposed to asbestos, silica, and coal dust. I'm going to take a deep dive into what does the Alberta Code and Saskatchewan regulation, OHS regulations say around requirements for companies. So here's where we're going to go today. We're going to talk about who is an exposed worker, understanding OHS requirements, and exactly go into some more detail around what does the medical examination process look like. Talk about, what is a chest x-ray, what's involved, health assessment, what's involved, pulmonary function test. If you haven't done some of these tests yourself, it can be hard to understand. Well, what am I sending my workers to be tested for? What is this test all about? So I'm going to explain some of that today. I know sometimes when we work in management or HR or safety positions, you maybe haven't had to do some of this testing yourself. So it's important for us to, those of us who are managing these parts of our processes in the company to understand what this testing is all about. So to kick us off, who is an exposed worker? So what I put up here on the screen is I've taken this direct from Alberta and Saskatchewan OHS code, and I've got the books. You guys probably have the books too, or you can download the versions of each of the code and the regulations online as well. You can get most of the information for free online. You can just Google Alberta OHS code, Saskatchewan OHS regulations, and you can find it online. Maybe I'm a little old school. I like a paper copy. Downside of that is when it's updated every year, a couple of years, you gotta get a new one. So when you do it online, of course, you're always getting the most recent versions online. But directly from the books, who is an exposed worker? Alberta OHS says a worker who may be exposed to asbestos, silica, or coal dust. So maybe in lots of these policies that we read, maybe becomes a word that is really important. And you as a company get to decide who is or who is not an exposed worker. So may be, well, are they day to day? Some of those are pretty cut and dried. You know who your team is that's working in with these products. But if they may be, this could even just be a one-off. Alberta OHS would say that person qualifies as an exposed worker and should have medical assessments completed. And we're going to get into those in a bit. So Alberta says a worker who may be exposed. Saskatchewan says a worker who is regularly employed in an asbestos or silica process. So one thing I just want to point out here is Saskatchewan OHS regulation, while it does talk about workers who are exposed to coal dust, they don't go into as much detail around medical assessments of workers who are exposed to coal dust like they do with the Alberta in the Alberta OHS code. So officially, when we talk about it today, Saskatchewan, we're talking about workers who are exposed to asbestos and silica. Now, in my professional opinion, I would say workers who are exposed to coal dust in Saskatchewan should also be subject to the same testing requirements as we're going to go through today as those are exposed to asbestos or silica. And through conversations that I've had with our occupational health physician, I know that he would agree with that. But the Saskatchewan OHS code does not say, workers who are exposed to coal dust need to go through the medical testing that we're going to talk through today. So there's one difference there between the two provinces. So I put the details on the code, the part, for Alberta, part 4 dash subsection 40 there for Alberta. So I put those in here for you if you want to go and look them up later for yourself to find out the details. So to start with, let's look at Saskatchewan. I know most of you that are on today, you probably got workers that work in both provinces, so you get to adhere to the regulations in both provinces. I will say, Alberta is a little bit more in depth and requires more testing than Saskatchewan, which we'll highlight. So some of you might say, if you've got workers working in both provinces, which do we follow? In my opinion, I would say if you're following Alberta, that's a higher not a higher standard, but they've got more, they require a bit more for their testing. And if you got workers in Saskatchewan, but you adhere to the Alberta requirements, you're also going to be in compliance with everything that Saskatchewan is asking you to stay in compliance about. So if you're in both, I would say look at Alberta, do that one, and everything Alberta is asking, you can rest assured you're going to be in compliance with Saskatchewan as well. So some details about Saskatchewan. What they're asking for is a worker who's regularly employed in asbestos or silica process. They're saying not less than once every 2 years, the worker shall arrange for a medical exam. The employer shall arrange for a medical exam of the worker during workers' normal hours. The company must reimburse the worker for any costs associated. They need to be paid for their time and the costs associated with the testing. And if a worker cannot attend during normal working hours, an employer shall credit workers' attendance and the examination as time at work. So a little bit more about what the Sask OHS reg says. The medical exam must include a comprehensive medical history, so a questionnaire essentially about past exposures, a history of that worker's exposure, and a physical exam with special attention to the respiratory system. The medical exam should also include lung function tests, You may have heard the term spirogram or the term pulmonary function test. That's what we're talking about here. Lung function test, which includes forced vital capacity and forced expiratory volume at 1 second. You don't really need to know what that's all about, the forced vital capacity, forced expiratory volume at 1 second. You can rest assured that when you send your workers to us at Assure, we're testing at those requirements, and we're going a little bit deeper as well in all of our PFT, all of our spirograms. So I would say don't get too hung up on what is forced vital capacity, though we could get into that happy to get into that on a phone call or one-on-one. Last point there. Medical exam must include any further medical investigations that are necessary for the diagnosis of an asbestos-related disease. So what that could include there is in Alberta, one thing that Saskatchewan doesn't require in these assessments is a chest x-ray, for example, where Alberta does. Saskatchewan doesn't require a chest x-ray. So point C there allows room for a doctor, the occupational health physician might say, based on the health assessment, the medical history, based on the results of the PFT, I'm going to ask for a chest x-ray. So the physician might ask for some further medical exams or investigations. That's just one example of what the physician might request, which Alberta includes. So summary of what Saskatchewan is asking. I like just quick summaries. Tell me, pare it down for me. What do I need to do? In Saskatchewan, any of your workers who are exposed to asbestos and silica, what they need is every 2 years, a medical exam, which includes a health history and a physical exam. They must be seen in person by a health professional, and they must complete a pulmonary function test. And again, a PFT is also known as lung function test or a spirogram. So that's what's required in Saskatchewan. Now let's move on to Alberta. So I put in here, here's the details about where to find this section in the code, part 4-40. I haven't put everything on here like I did with Saskatchewan, just because it's a lot more in depth with Alberta. And I put that link there about where you can find it on the alberta.ca website, the details. Because it's just a lot more, they go into a lot more details about exactly what needs to happen in a spirogram, what needs to be included in the health history. So we'll mention some of the high level details here, but I recommend that you go and have a look at exactly what's in there for yourself. And rest assured that when you're sending and referring someone to us at Assure, one of your exposed workers, that we're well versed in the OHS code, and we're making sure that we help you stay compliant with the code. So what does Alberta say? Any workers who are exposed to asbestos, silica, and coal dust within 30 days of exposure, they need to complete the testing that's we're going to get into in a second. So within 30 days of exposure, and then every 2 years ongoing. So that's the one difference there with Alberta and Saskatchewan. Saskatchewan just says every 2 years. Alberta says within 30 days of exposure and then every 2 years. So Alberta says these exposed workers need to complete a health assessment. So what's included in that health assessment is a history of exposure. So this is a questionnaire. They come into our office. We give them a questionnaire that includes questions around, tell us about your exposure to asbestos, silica, coal dust, and then many more substances that we ask them about their exposure to. Other carcinogens, for example, smoke. What's your smoking? Smoke as in fire smoke, as well as what is your smoking history? Do you have any prior diagnoses of respiratory diseases? Things like that. So we do a health, a questionnaire. A nurse, an RN, or an LPN is then reviewing that questionnaire in person with that exposed worker. Then in that same appointment, we're going to complete a pulmonary function test, again, lung function test or spirogram. Alberta OHS code says this worker also needs to have a chest x-ray completed with a radiologist report. So an interpretation or report of the chest x-ray. So they do give, Alberta does give a bit more details about that, details on what kind of chest x-ray in the code. So those details can be found in the code. So chest x-ray, and then all of that, the health assessment, pulmonary function test, and the chest x-ray must be sent to a physician. All of that must be reviewed. And then that physician must give their findings of their review and any recommendations that they would make for treatment or care. So the physician that we use at Assure is an occupational health physician. It's not a family doctor. It's an occupational health physician who's got specialized training in workplace-related illnesses and specific details. And they also understand the OHS code and regulations in a deeper way than a family physician does. So that's Alberta OHS. As we go through, if there's any questions, please just put them in the chat as we go, or interrupt me and mute if you've got any questions as we go. So talk a little bit about what are each of the tests that you're sending your workers for. So one of the things that's involved in this is a pulmonary function test. So this assesses lung function. So the process, what the test, what can I expect if I'm coming in for a pulmonary function test? This is, it's a pretty, physically demanding test. Those of you who've done it, when we ask, have you ever done this before? And they're like, I don't know. When we say it's the one where you've got to blow really hard into the machine, most of them that have done it will say, oh yes, I remember that one. It's a memorable test. And why is because you have to blow as hard and fast as you possibly can and maintain that for a minimum of 6 seconds, as long as you can. And then we have to do at least 3 consistent readings, meaning 3 consistent similar blows of that same forced expiratory volume to get an accurate reading. So before we even do the test, we take everybody's blood pressure. We want to make sure a person's blood pressure is within an acceptable range, just because it can be a really physically exerting exam. So we want to make sure if you've got high blood pressure, we're not going to put somebody through this testing. So it involves holding a machine to your mouth. You inhale, fill up your lungs fully and completely, and then quickly and as fast as you can, blow all the air out of your lungs as quick and fast as you possibly can. And again, maintaining that blowing for minimum 6 seconds. If you can go longer, go longer. And then doing that minimum 3 times. We need 3 readings that are consistent, close to each other. So then once that's completed, this same test, how a pulmonary function test was created and how they came to create it was the same test was given to thousands of people across a broad section of broad demographic. So it was given to men, it was given to women, it was given to multiple ages of people, it was given to multiple races of people of different weights, people of different heights. So then when a worker comes, we input their age, height, weight, race, and sex. And then their results are then compared to other people of similar age, height, weight, race, and sex to see where does your lung health compare against the norm. So then, for a 40-year-old man of this height and weight, it's expected that your results would be in this norm. So if you've got poor lung health, it will show that. Restrictive lung disease, something like that. So it's comparing a person against a norm. That's what's done. So yes, I think we've covered that. The PFT. So that's a PFT test. That's one of the tests that's required. Health assessment is also required. So again, this is a questionnaire that's given to a worker when they come into an office or one of our many clinics that we have across the country. And questionnaires given asking about their smoking history. Have you had any past respiratory diagnoses? What's your exposure to airborne contaminants, carcinogens, things along that nature? It's then reviewed by a nurse in person, going a little bit deeper, asking getting any further information that they need. And then that is sent to occupational health physician who provides findings and recommendations. So the chest x-ray. So the Alberta OHS code gives these details, saying that they want a 35 centimeter by 43 centimeter posterior-anterior view check stress rate completed. That must be completed along with a radiologist's report. And again, that's also reviewed by the occupational health physician, providing his findings and recommendations. So most clinics like ours aren't completing the chest x-ray in our office. We are outsourcing that with one of our partners. We coordinate the entire process, though. You book a worker with us. We take care of the booking of the chest x-ray, getting those results back to us, making sure everything is sent to the physician. That comes back to us. We provide the report and the findings to you as well as to the exposed worker. So a question that we get at the end of these, I like to think about, what are the most common questions on any of these educational webinars that we do. And one of them that came up recently from firefighters was, what do we do for workers, firefighters who are exposed to smoke, like fire, smoke? So this was actually a new one for me that I got to look into, got to have a conversation with our occupational health physician, where I assumed he would say follow the same processes, and that's exactly what he said. For a firefighter, he said there's whole documents based on policies and procedures for firefighters as well, who follow the exact same process. Health assessment, chest x-ray, pulmonary function test, reviewed by an occupational health physician. So that's the same process that a firefighter or anybody, some of you might have workers who work in the north or work in forestry industries like that, where they're around, in the summer, there's lots of fires around here, of course. So the same would be the recommendation. Though OHS might not say, have a specific regulation around it, best practice would be, from an occupational physician standpoint, best practice would be to follow the same health assessment requirements there. So another question that we get is, whose physician do we need? So, John, I read the OHS code. It said it needs to be reviewed by a physician. Do we use the worker's family doctor? Do we need to have a physician, a company physician? What's best practice here? So quick answer is, best practice, in my opinion, would be an occupational health physician over a family physician any day, because family physician isn't trained, doesn't have specific training in the workplace and this, the different nuances of OC health and the codes and regulations and specific needs of a workplace and safety sensitive workplaces. So the physician that we use for these reviews is an occupational health physician. Now, we use a GP for other assessments, but not for these, because we want somebody who understands the code and exposure and helps you stay compliant with, Alberta and Sask OHS code and regulations. That's one side of it. But we also want to work with physicians who understand that it's important to share information with HR safety managers in a company. Some physicians, in my experience, it's particularly GPs, when we've tried to work with GPs on a workplace issue, it's harder for them to understand that, yes, there's some information that can be shared with the company and should be shared with the company while maintaining confidentiality. A lot of GPs, in my experience, will feel like I can't be sharing any information with a company. That seems like a breach of confidentiality. So again, we work with occupational health physicians or just physicians in general who understand that I'm not going to share all of the medical health history information So all of that, the details we don't share with you as a company about their past exposure. You don't get all those details. So that would be a breach of confidentiality. But what you get is the high level, what are the findings of these assessments, and what are the recommendations for ongoing treatment and support. So that's another reason why we recommend don't use the employee's family physician, though there might be one who understands this process and might be really helpful. So I will leave room for that, but I will say, it's the easiest and it's the best. Use our physician who this is what he does. This is his dedicated practice he reviews our audiometric abnormals. He reviews PFT, any of our abnormal health assessment, physical abilities testing. He understands the specific needs of the workplace. So another question, who pays? The code and the regulation for both provinces spells it out pretty clearly. Companies responsible to pay for the employee's time to attend this test. So, and if you say, well, we can't send them on a day off because they work remotely or they're on site. Sometimes it doesn't work to send them on a regular work day, but if you're sending them on a day off, that you're compensating them for their time and that the company's covering the costs of all the testing. So that's basically what I've got for us today on understanding Alberta and OHS code around asbestos, silica, and coal dust. So just to summarize briefly again what it is, Saskatchewan says every 2 years for an exposed worker for asbestos and silica, they're completing a health assessment and a pulmonary function test, which is then reviewed by a physician. Alberta says within 30 days of exposure, a worker, and then every 2 years ongoing, a worker must complete a health assessment, a pulmonary function test, and chest x-ray, which is then reviewed. So if there's any questions, again, put them in the chat, or my information is there, john@assuretesting.com. Give us a call at the office. Carrie Ryan is our operations manager. She would be more than happy to answer your questions about getting your workers booked in for this, helping you write policy around it, and helping you stay compliant. So we are going to leave it there for today. Thank you so much for being here with us. It's been a pleasure. And as always, let us know how we can support you in staying compliant.